23 Early warning signs of heart disease. You should look out for chest pain or discomfort. Chest pain or discomfort, especially during physical activity, can indicate a heart problem, such as angina or a heart attack. Shortness of breath. Shortness of breath during physical activity, or even at rest, can indicate a heart issue, such as heart failure. Fatigue or weakness. Fatigue or weakness, especially during physical activity, can be a warning sign of a heart problem. Rapid or irregular heartbeat. A rapid or irregular heartbeat can indicate a heart issue, such as atrial fibrillation. Swelling in legs, ankles, or feet. Swelling in the legs, ankles, or feet can be a sign of heart failure or a blood clot in the legs. Lightheadedness or dizziness. Lightheadedness or dizziness can be a sign of a heart problem, such as low blood pressure or an irregular heartbeat. Nausea or indigestion. Nausea or indigestion can be a warning sign of a heart attack. Cold sweats. Cold sweats can be a sign of a heart attack, especially if accompanied by chest pain or discomfort. Pain or numbness in the arm, neck, jaw, or back. Pain or numbness in the arm, neck, jaw, or back can be a sign of a heart attack. Coughing or wheezing. A persistent cough or wheezing can be a sign of heart failure. Rapid weight gain. Rapid weight gain, especially if accompanied by swelling in the legs, ankles, or feet, can be a sign of heart failure. Trouble sleeping. Trouble sleeping or waking up frequently during the night can be a sign of heart failure or an irregular heartbeat. Shortness of breath when lying down. Shortness of breath when lying down can be a sign of heart failure. Snoring. Loud snoring or pauses in breathing during sleep can be a sign of sleep apnea, increasing the risk of heart disease. Unusual fatigue or weakness. Unusual fatigue or weakness can be a sign of heart disease, especially during physical activity. Fainting or dizziness. Fainting or dizziness, especially during physical activity, can be a sign of an irregular heartbeat or a drop in blood pressure. Chest pressure or tightness. Chest pressure or tightness, especially during physical activity, can be a sign of angina or a heart attack. Persistent cough or wheezing with white or pink blood-tinged mucus. A persistent cough or wheezing with white or pink blood-tinged mucus can be a sign of heart disease, or a lung problem can affect heart function. Palpitations. Palpitations or feeling your heart racing can be a sign of an irregular heartbeat or arrhythmia. Difficulty breathing or shortness of breath with physical activity. Difficulty breathing or shortness of breath with physical activity can be a sign of a heart or lung problem. Increased urination at night. Increased urination at night can be a sign of heart failure, as the body tries to remove excess fluid. Swelling in the abdomen. Swelling in the abdomen, especially if accompanied by weight gain, can signify heart failure or liver disease. Bluish lips or skin. Bluish lips or skin, especially during physical activity, can be a sign of a heart or lung problem, as it can indicate a lack of oxygen in the blood. When should I consult a doctor? If you are experiencing any of the following symptoms, it is important to seek medical attention right away. 1. Chest pain or discomfort lasts more than a few minutes or comes and goes. pain or discomfort in one or both arms, the back, neck, jaw, or stomach. 3. Shortness of breath with or without chest discomfort. How common is heart failure? Heart failure is a very common condition, affecting an estimated 5.7 million adults in the United States alone. It is estimated that about half of all people over the age of 65 have some form of heart failure. Heart failure is also more common in men than women, and African Americans are more likely to develop heart failure than other racial or ethnic groups. What are the different types of heart failure? Heart failure is when the heart cannot pump enough blood to meet the body's needs. It can be caused by a variety of conditions, including coronary artery disease, high blood pressure, and diabetes. There are two main types of heart failure, systolic and diastolic. Systolic heart failure is a condition in which the heart muscle's ability to contract, the systole, becomes impaired. Diastolic heart failure is when the diastole, or when the blood pressure in the arteries decreases, causes tissue damage. Some symptoms of heart failure are shortness of breath, fatigue, weakness during exercise, rapid weight loss or rapid weight gain, palpitations with no known cause, and chest pain that may indicate a more serious problem. What is congestive heart failure? Congestive heart failure, CHF, is a condition in which the heart cannot pump enough blood and oxygen to meet the body's needs. This can lead to fluid buildup in the lungs, legs, and other organs. CHF can be caused by several conditions, including coronary artery disease, high blood pressure, diabetes, and valve problems. Symptoms of CHF include shortness of breath, fatigue, and weakness. The severity of symptoms is often determined by the volume of fluid in the lungs. Most cases require treatment with medications to help clean out deposits in the lungs and other body parts that have built up fluid caused by heart failure. A heart transplant may sometimes be necessary to restore cardiac function. What are the stages of heart failure? Heart failure is when the heart cannot pump enough blood and oxygen to meet the body's needs. It can be caused by a variety of conditions, including coronary artery disease, high blood pressure, and diabetes. Heart failure is classified into 4 stages based on the severity of symptoms and how well the heart is functioning. Stage I, mild symptoms of heart failure. In stage I, the heart can still pump blood and oxygen to the body. This stage is divided into 3 substages. Substage 1 is characterized by reduced exercise tolerance, substage 2 is characterized by fatigue, and substage 3 has fluid retention caused by swelling in the ankles and feet. Stage 2, serious symptoms of heart failure. In stage 2, the heart cannot pump enough blood and oxygen to meet the body's needs. Symptoms may include shortness of breath, dizziness, tiredness while resting or during exercise, and nausea. Stage 3, symptoms of heart failure worsen, with fluid accumulation in the lungs and pleural cavities, a rapid and weak pulse, mental confusion, convulsions. Which tests are used to diagnose heart failure? When it comes to diagnosing heart failure, there are a variety of tests that can be used. These tests help doctors determine the cause and severity of the condition and how best to treat it. The most common test used to diagnose heart failure is an echocardiogram, echo. This test uses sound waves to create images of the heart and its chambers. Other tests that may be used include cardiac catheterization. This test can be done several times during heart failure treatment to monitor the progress and effectiveness of treatment. A catheter is threaded through a patient's artery into the heart, injecting or withdrawing fluid or collecting blood samples for further testing. Cardiac MRI scan. This scan helps doctors understand how the left ventricle functions and whether any scar tissue has formed from previous damage to help determine if repair techniques should be applied. Electrocardiogram, EKG. The EKG is used to measure the heart's electrical activity, showing the strength and timing of heartbeats. X-ray. This X-ray helps doctors evaluate abnormal cardiac valves, assess for any extra fluid in the lungs when fluid may be causing shortness of breath, and determine if there are any calcium deposits that could lead to a heart attack or stroke. Infrared imaging for heart patient. Infrared imaging uses infrared light waves to create images of the body. It is a non-invasive technique that can be used to diagnose and monitor heart conditions in patients. Infrared imaging can be used to detect blockages in the coronary arteries, abnormalities in heart muscle function, and other cardiac abnormalities. This technology is especially useful for diagnosing heart disease in patients who are at risk. Ultrasound scan, plain X-ray, CT scan. The final step in evaluating a patient with a foot ulcer is determining if the patient needs additional treatment or procedures, such as surgery. If surgery is needed, it should be performed within 30 days.